Hi, my name is Jill White-Huffman. I'm a licensed professional counselor, and I'm also a marriage and family therapist here in Greensboro, North Carolina. I do invite you to visit my Facebook page. I always try to have some type of topics, things that hopefully are interesting to you and something that can certainly inspire or help you. Or maybe it's a family member, a friend that you see or know that could benefit from some of this information. So visit my Facebook page and visit some of the topics that I talk about. Now today what I've come to talk to you about is postpartum depression. In my private practice, I see a lot of young ladies who struggle with postpartum depression and just don't really understand kind of what it's all about. And so a lot of times with postpartum depression, what women will experience, of course, is a lot of physical changes. One of the things that most often happen is that the hormones will drop drastically, and so your progesterone, estrogen drastically drops, and of course the thyroid levels do drop. So what that causes is that a lot of the women that I talk to will say they feel very sluggish. It's just really hard to get themselves motivated and that they're tired all the time. They also complain about a lot of emotional issues. So it could be some depression, anxiety. Of course, they become anxious about their self-care and, of course, how they're going to care for their child. Becomes a very concern for a lot of mothers. They feel like they're inadequate and that there's nothing that they can do that as a mom that would be appropriate enough or enough to care for the child. So they become very anxious. The other thing is that women who struggle with postpartum depression, some of the emotional challenges that they have is that they don't like themselves anymore. They feel like they may be overweight, their body, because it changes drastically, and they'll feel very unattractive. And so they have a sense of feeling like they're probably not going to measure up to their loved ones. So they'll feel, again, unattractive. Other things that they struggle with is their sense of identity. So even decision making sometimes becomes a struggle for those of you all that may struggle with postpartum depression because because of everything that's going on with you and how negative you feel like, even making big decisions or small things may, you wonder and you question and you are constantly asking other people about their opinion. So you don't trust your own judgment. The one thing that's really important too is that those of you all that do experience postpartum depression may feel like you're out of control. So when you get angry, sometimes it could go like from a 0, meaning no anger, to a 10 almost fast. So almost everything puts you on edge and makes you, extremely agitated. So, and it could be even the smallest things could make you just kind of really set off. And, what some of the I guess the educational pieces that I've learned over the past is that, when people are struggling with postpartum depression, I like to look at what Kubler-Ross, the 5 stages of grief. It's sort of, as I mentioned, having those big identity crises and just how everything is changing. It sort of correlates a lot with that cycle of grief, those 5 stages. So, individuals will kind of go through an anger stage. And so when they're going through that, they feel like nobody understands what they're going through. Of course, they deny. Sometimes they'll say, this is obviously not happening to me. Or, and then the other thing is that they may bargain and they'll say, well, if I do things like maybe if I exercise more or I eat better or I do things that are healthier for myself, then maybe this postpartum depression may go away, where it may be that there may be a higher level of care that may be needed. Because again, when you're going through the postpartum depression, that bargaining piece, it may be that, you may definitely, and I would always encourage anybody that's going through postpartum depression to certainly see their physician, but that may be something that they may recommend as a higher level of care, that some medication for a temporary period may be a little bit more helpful. Because, when you're going through those changes, as we talked about, the hormones changing, of course, the chemistry in the brain and everything is going to change as well. And so it may be a little bit harder for you to manage this postpartum depression. So along with counseling, you may need some medication. And of course, that would be up to your physician to determine that. One of the other cycles or stages that Kubler-Ross talks about is depression. Again, just feeling really doom and gloom, and you feel like everything around you is going down. You almost feel like maybe your child would be better off without you. So some people may experience a little bit of suicidal tendencies or ideations, and so, or they may just want to go away. So it's not like they're wanting to harm themselves. They may just feel like their child may be better off with someone else. So whether it's a family member, or they give their child up for adoption, or a friend, because they may feel inadequate. So and then of course the bigger piece too is acceptance. And so with Kubler-Ross and the acceptance stage, it's just really healthy for those of you all that may be struggling with postpartum depression to just really realize that this is normal. It's a normal process that happens with a lot of young ladies, older ladies, whoever experiencing childbirth, that it's not uncommon sometimes for these things to go on in your body that may make you react or think that you're going crazy or abnormal. And so once you come into that acceptance phase again, you're better able to reach out for help, and just know that help is not a sign of weakness. It's a sign of strength. The other thing that may happen is what we term PTSD, which is postpartum stress disorder. So that may be sort of like in that relapse moment of when things are going really good, you've accepted the process, you're getting counseling, you're seeing your medical doctor to get some medication, you're off doing really healthy things, getting into support groups, you're doing a lot of great things for yourself. Sometimes if you get into sort of a negative mindset of feeling like, oh my God, what if this happens again? So you may start fixating on, negative thoughts of, if this happens again, how can I deal with it? Or, and then what kind of trauma or what kind of pain will I cause to my child if I do relapse? And so remember, anytime we're making any changes, there's always, you're always taking steps forward, and then you may go back a little bit. You take steps forward, you go back a little bit. But the more you practice, these techniques in terms of, getting the help, the resources that you need, and following those regimens and the skills that you learn, you will get better. So I hope that this has been really helpful to you. For those of you all that do struggle with postpartum depression, again, in terms of the time frame, there really isn't a time frame. From the things that I've read and understand, is that, it could happen, you can start getting help. The sooner you get help, of course, is the best. So if you notice that you're kind of spiraling down after you've had your child, it's best to go ahead and reach out for help at that time. Because if you don't, the longer it lasts, the likelihood of your progression moving forward will be will be prolonged. So I've even had women that's come in to me who's had children, and their children could be even as much as 4 and 5 years old, and sometimes older, depending on if you've had multiple children. Because again, and what the years are apart, because all those things do. They do play a big factor. So if you feel like you're struggling, you know someone that's struggling, and maybe you may not know that it is postpartum depression, encourage them to watch this video, encourage them to reach out for help. My name is Jill White-Huffman. I'm a licensed professional counselor, a marriage and family therapist, and I'm also a licensed massage and bodywork therapist. Over the years, I've had the opportunity to work with lots and lots of individuals. In my private practice as a massage therapist, I've worked with just so many different chronic issues. I've worked with people that are just enduring a lot of stress. I tend to use a lot of different modalities. People will ask, Jill, what do you most specialize in? Of course, you'll be able to visit my website if you have an opportunity, and it'll tell you some of the things that I work mostly with, the modalities that I work and techniques that I work most with. But I will say, I don't call myself one particular therapist. I tend to try to work with the body, with the different needs and the different elements that you express, and those areas that I feel as I am working on the body that may need some help. So it just depends on what's going on, is the technique that I use. You know, as a licensed professional counselor, of course, you'll see that about 98% of the population that I work with are couples, but that does not negate that I do not work, that I will not work with individuals, because I do work with individuals. I work with individuals with just all types of issues. People come into me because, you know, they're making some life adjustment situations. They may be encountering some stress-related issues, adjustment, some grief and loss. I work a lot with depression, anxiety, and some of the PTSD as it relates to just some of the traumatic events that have happened in people's lives, or as it relates to, say, postpartum depression, or some of the infidelity issues that people have struggled or are working through. So again, I do encourage you to visit my website. I have a lot more information there where you can learn more about me. And also go over to my Facebook page. There's so many different topics that I write about, and hopefully there's some tips that I can share with you, some things that may be helpful to you with different issues. So as it relates to something physical, as it relates to something emotional, or it could be mental, emotional, or physical. So again, rush over, look at my Facebook page, and I hope you'll enjoy reading some of the topics. Now, I hope that, you know, the segment that I'm sharing today has certainly been helpful to you. If you've got any questions, do feel free to call me. The number, it's 336-855-1860. 336-855-1860. Thank you.